Today I'm showing you an exercise routine to relieve sacroiliac joint pain or SI joint pain during pregnancy. If you're pregnant and new to this channel, make sure you subscribe and click the notification bell below so you don't miss any of my pelvic health tips for an empowering birth and postpartum recovery. So SI joint pain is experienced as a stabbing pain in the joint right here. So either on the right or on the left, it's often more one side than the other. The reason why it's happening more in pregnancy is because your body is looser from the relaxin hormone, and that can make that joint unstable here. And when it's unstable, it gets jammed, and that is what that stabbing pain is. So in this exercise routine, I've included both mobility exercises to free up the joint if it's jammed, and also some strengthening exercises to improve the stability of the joint and avoid for that misalignment to happen. So we will start sitting on a chair with a mobility exercise. So we're gonna do pelvic tilts. So for pelvic tilts, I like to imagine my pelvis as a bowl of soup, and I wanna tilt forward to pour the soup forward and then pour backwards. So I'm just rotating my pelvis back and forth. Okay, very gentle here, respecting what your body is telling you. If there is any pinching or stabbing pain during that movement, you want to find the range where you can still do that but without pain. So maybe that will mean tiny movements for you, but just trying to get some mobility in your pelvis. One good image that I like also for pelvic tilts is to picture a pole going through my hips, and I want to rotate around that center of rotation. Okay, so just doing a few of those. I like to do 5 or 10. And if you had an exercise ball and you preferred to sit on the exercise ball for this, go for it. I suggest that your ball is inflated enough so your hips are a little above your knees. But I wanted to make this routine as accessible as possible for everyone who don't have equipment, so that's why I'm using a chair. Our next exercise is going to be a stability exercise. So we're going to use our fist, put them in between our knees, and now we're going to squeeze our fists. So nice gentle contraction of our inner thigh muscles called the adductors. And we want to keep this for 5 seconds. Great job. Now we're going to do the opposite. We're going to go sideways. So you can put your hands on the exterior and just press to try and push your hands. So 5 seconds here. And again, so we're gonna repeat that 5 times. Other options, if you don't want to use your hands, you could have a yoga block here and squeeze your yoga block. And you could have a strap around your knees and just press against the strap. But as I said, I wanted to keep this pretty low equipment for everyone, so that's why I'm giving you this option with the hands. Good. Our next one, we're going to do a figure 4 stretch. So you're gonna bring your foot to the opposite knee, and then you're just going to slightly bend forward to feel a stretch in your buttock. Okay, and those muscles are connected to your sacrum bone, and when we have SI joint pain, often those muscles are tight. So you want to stretch them out to make sure that your sacrum can be sitting nice and in the center. So I really like this one, you know, as a office stretch as well. You know, if you have a sitting work, you can even be typing as you're stretching, right? It's nice and easy to integrate. And again, we don't want to go in a stabbing pain. We want to feel a stretch in the buttock. And we can do it on the other side. There's always one side that's tighter than the other. For myself, it's the left, so I can definitely feel like I can't go as far into my movement. You don't want to round the back with this stretch. You want to keep your back nice and straight. And if that feels good, you can even do a little bit of movement, you know, little circles with your upper body to just warm it up. Awesome. Now we're going to move to the floor on our yoga mat. So you're going to go on all fours, have your knees hip width apart, and you're just going to go back and forth. So again, going in the range that feels good to you. We don't want to create any stabbing pain in the joint. And depending on your belly bump size, you may want to have your knees a little more wide so you can go and sit on your heels. But again, if for you that just feels right in this range here, just keep it small. Don't feel like you need to go all the way down. But if it is available to you, you can do it all the way down to your heels. Doing a few times. Great. Now you're going to move to your side very carefully. Ideally, for these exercises, because they're going to be strengthening exercises, I like to prioritize the side that is problematic. So if your right SI is the problem, then I would strengthen more on the right side versus the left if you have limited time. So the first strengthening exercise will be clamshell. So you're going to keep your knees bent, your feet are together, and you're just going to slightly open up and then come back down. Again, going in the range that feels non-painful. It may mean that you're going to go just up halfway, which is fine. But you should feel the muscles here in the hip working. One thing that I want to point out is a lot of people end up kind of turning their body upward toward the ceiling, which makes it way easier to lift that leg up. So you want to make sure that you keep your body nice and perpendicular to the floor and you don't rotate here. So let's do 10 like this. For more challenge, you're not going to rest in between reps. You're just going up and down without resting. But if you need a break, you can definitely rest here halfway through your set. Awesome. Our next one, we're going to have the bottom leg flexed and the top leg is going to be straight, and we're going to go up and down. So strengthening the side muscles. They're different muscles than the ones that we just strengthened with the clamshell. They're more like the ones on the side here versus with the clamshell, they're more the rotator muscles. So 10 here. And if you need to, you can have something in between your legs, like a pillow or a cushion or something, to avoid crossing the midline when you come back down, because when you're in an acute episode of SI pain, it can feel pretty stabby to like cross the midline. So you may want to have something to make sure that your legs stay parallel throughout. And again, like with the clamshell, you don't want to start turning up toward the ceiling. You want to stay nice and perpendicular to the floor. And also you don't want your leg to go forward. So that is another compensation that we often see when people are weak there. So you want to keep it nice and straight with your upper body. So 10 reps here. If you have time, I would encourage you to do those 2 exercises on the other side, so your clamshell and your side lift. But for the purpose of this video, I'm just going to demonstrate our last exercise, which is the bridge. So you're gonna turn onto your back. Depending if you have any symptoms on your back in pregnancy, like short of breathness, dizziness, nausea, you may want to prop yourself up a little bit with cushions. But for myself, I'm feeling fine. So what I'm gonna do is push onto my heels and bring my pelvis up. Again, I've had bad SI pain at the beginning of my 2nd trimester, and even the bridge didn't feel quite good to me. So what I did is I've put a yoga block in between my knees. It could be a cushion or something, I would say pretty firm to squeeze, because when you're squeezing the block, it provides a bit more stability into the pelvis. So that is another option, and I would just go as high as I can without feeling the pain. Okay, so we just want to engage our glute muscles. Picturing picking up a penny with your butt and squeezing it in the butt crack and then coming back down. So don't go too far up if that doesn't feel good. 10 reps here. Good job. Great. And one last mobility exercise that I like for SI joint pain is the side lying stretch. So what you're going to do is extend your leg, and you're going to cross over that top leg all the way to the other side, and just enjoy that stretch here. And sometimes I even do it on the side of my bed, so my top leg can hang over the edge of the bed, and I can really feel the stretch here in the SI joint. But again, if you are in an acute episode, I might not recommend this because that could create more pain than not. So you really want to be cautious with these movements and really tune into your body. And we want to balance it by going on the other side. So my bottom leg is straight, my top leg is just crossing over. Sometimes you may hear, like I just heard a crack here in my lower back. That actually felt quite good. It's fine to hear some cracks for as long as they're not creating pain. We want to keep it for 30 seconds, 60 seconds, and then come back. I would recommend doing these exercises daily, or at least 3 to 5 times a week if you want to get the best results. And I would also recommend continuing them once your pain subsides, because the goal is not to do them just when you have the pain, but also to continue building that stability over time. If you want to learn my best pelvic floor tips to prepare for an empowering birth, download my free book in the description below. My goal is really for mamas to feel more confident in giving birth and giving them some concrete tools to prepare their body for a positive birth experience. I hope this video was helpful to manage your SI joint pain, and I will see you later in another one of my videos. Thanks for watching.